Does it say live, Luis? Okay, sorry, I gotta check in on my D. Okay, guys, April Lopez here, Lopez Family and Wound Healing Clinic. We're very excited to be at our Wound Healing and Amputation Prevention Conference. Why did we start at 7:30? Because I have a lot of night shift brothers and sisters that get off of work. I love you, Suzanne from Solera. And they're off shift, and last year they tried to come. I have a lot of people from the hospital like, you guys do the conferences, you start at 10, we just got off shift. So I wanted to have it available for people to come, grab some breakfast and go. We're very excited about what we're doing. We're very excited about our vision. Those of you that follow us on Facebook, sign up to our YouTube channel, Lopez Family and Wound Healing Clinic at YouTube. We share a lot of stuff that's very important for our community. We share a lot of good information that's very important for patients, for family members, for clinicians. Our vision is to stop amputations here in the Rio Grande Valley. It is shameful that we're in the top 3 in the country for amputations. It's ridiculous. We have this compadre mentality where we're not calling people out when we need to be patient advocates. We are patient advocates. We will speak for the patient. We have to speak for those that have no voice. We have to be their voice. So this is an encouraging conference. This is a conference where we want to empower clinicians to learn a little bit more about what we're doing, to share our vision. Last year we had an amazing conference and we threw it together in a few weeks. And we're not charging for the conference. It is for licensed individuals only. And people always tell me, hey, boy, you need to charge for the conference. This is really a chat with my friends, people that are already in the community, referring patients to us, calling us for some input, calling us from Brownsville saying, we have a patient that has a black leg, but the patient doesn't want to amputate, April. What do you recommend? Well, I recommend you empower that patient. I recommend that they seek a second opinion. Guys, don't call us when the patient is already about to get an amputation in the hospital and expect us to do something. Call us when the patient has a tiny little discoloration of that toe. Call us when the patient has onychomycosis. Call us, because those things have to be addressed. I want to introduce to you Dr. Osman Quintana. He is our revascularization specialist. He is a cardiologist, many, many years. You guys know him, Heart Clinic. And he's doing a lot of interventional cardiovascular work. He is doing amazing things for the Valley. There's cases that he's working on that have never been done before. He's worked on patients starting from the foot. He did a case recently from the arm. And how do you revascularize from the arm? Well, he's doing this. Okay, I want him to share a little bit of his vision. And then this is Dr. William Martin, who's like my dad. And he's also always been very, very supportive of everything that we do. He himself is an interventional radiologist. He is a radiologist in the Valley for how many years, Doc?
Too many years to count.
Too many to count. Sometimes I have to chart that on my wound care when I run at the hospital. Like, patient has wounds from the right leg to the toes, too many to count. And so don't send us a patient when it's too many to count. So Dr. Quintana, give us a little bit spiel on what is your vision, why we're doing this, and why it's important for people to know that there is an option to amputations.
Well, everything started from a few years back when then all the medical community find out that at least 90% of the people that can get amputated can be saved with new modern technology. And barely 50% of those patients that have peripheral vascular disease has amputation as a first form of treatment. So
amputation as a first form of treatment when only 50% have PVD. Why are we doing this? It needs to stop. And then, doctor?
Well, that create the impetus for a physician to look for the way to prevent this, and that's what this peripheral vascular disease treatment is in really revolution. So we invite you to listen to our conference, and you will find out what we're doing.
If you're a clinician, you RSVP'd, we welcome you. Those of the other clinicians that text me in the last 3 days that if we had a chair for you, just come on over. Yes, we have a chair for you. I already answered you. Dr. Martin, you've seen my work. You've seen some of the patients that I've sent you. What do you want to impress upon the community? What do you want to tell people about the options they have in healthcare?
Well, one of my interests has always been is early detection and prevention of problems in the first place. And this goes with a wide spectrum of disease processes. But diabetes can be reversed even without medicines. But it's a matter of taking the time with the patient to help them understand what kinds of foods are good to eat and not, with what kind of how to best lose weight in a healthy way, and keep that weight off, etc. So if you can work from that end to find out who's at risk and or help to reverse disease processes, these issues will not even come up in the first place.
So very preventive vision. Dr. Martin introduced me to a lot of prevention back in 2002. I've been doing wound care for 21 years. Nurses get taught wound care in our schooling, in our training, and we are the ones that do the wound care on the floor, in the home health. We are the ones letting the practitioners know this is working, this is not working. And so now I find it very empowering and very appropriate that we are actually now becoming providers, and we're driving the healthcare for these wound patients in conjunction with a huge team. We have a huge team. You can't heal wounds alone. If you think you're a wound care specialist and you're gonna keep your patient in your clinic so they can come week after week after week and you can see 60 patients because that's the volume you would like, and you're not referring to infectious disease, and you're not referring to vascular to assess that horrible PVD with all the occlusions, that is the reason why you're not healing your wound, and you're not referring to surgery for an in-depth surgical debridement because you think just going like this at the top of the wound is going to help you heal your wound, and you're not referring to interventional radiology or tests, workups that help us guide the care for the patient, including infectious disease, then we are causing the patient a disservice because you're not going to heal the wound. And the time is coming. They're already tracking our markers, guys. The time is coming where people are going to get paid per performance, as it should be. People should get paid for performance. And so our goal is to let people know, 1, how do you heal wounds? 2, you have an option. 3, stop telling people you're going to cut their legs. We get a lot of pushback. I have patients that walk into my clinic. They saw a video like this on Facebook, and they have a pretty bad looking foot with a black toe, and the whole foot is swollen with cellulitis. Clearly there's infection. And they were told by 5 different practitioners, we need to cut your leg. They haven't even touched the foot. They haven't even touched the wounds. You can't decide you need to cut your leg without doing a proper workup. It takes a village, it takes a team. And I always employ a lot of nurses. Nurses are gonna be your glue that keeps a healthcare team together, because the nurse is gonna get personally involved with the patient. The home health nurse is gonna make sure that the wound's looking better. April, this is not working. Ms. Lopez, we need to modify this. The wound care nurse in the clinic is gonna make sure that the patient feels empowered to be able to conduct their own wound care if they don't qualify for a nurse at home. They're gonna be your eyes and ears. In healthcare, we are a team. We need to use all of the different licenses to help us. Physical therapy. You're not using physical therapy, so your patient got disc atrophy. We had a patient come into the clinic. 60-year-old woman walked into the hospital for a knee replacement, is in a wheelchair with bilateral foot drop and heel wounds from never having gotten up. This is shameful. This is happening, so we need to stop it from happening. So that's what the conference is going to be about. We're going to get started in a little bit. I just want to share with you guys our vision. Within the conference, we'll be doing a few live feeds. We're not going to do the whole conference. It's going to take too long. But I want you to leave us, Dr. Quintana and Dr. Martin, with one thought, one takeaway of why we do what we do in healthcare. And I want you to say it loud, because they're both, as you can see, they're my balance. They're calm, patient, and soft-spoken. Okay? And I'm actually very soft-spoken now. You should have seen me 20 years ago, right, guys? I would get them dizzy.
She really hasn't slowed down.
I have. So leave us with a thought. Dr. Quintana, Fran knows I have, right, Fran? I slow down a lot. Leave us with a thought that you want people to know why they need to know what we're doing and why they need to get involved. Everybody needs to get involved. How do you get involved? Spread the word. That's good enough. Okay? So what is... No, you say it. You're when he gets mad, if you watch him speak, he's gonna get real passionate there, and then he's gonna start yelling a little bit. But I want you, you know, in your heart of hearts, in the convos we've had, what is your reason for doing what you do?
Okay. In the first place, that's the reason that I became a doctor. Help people. The first notion is alleviate the pain, and these people live a miserable life. So that's why I'm here. That's what I'm trying to do, what I do. So alleviate the pain is my first goal. The rest comes with the training that we have.
Thank you, Doctor. Dr. Martin.
Yeah, no, I just like to say one thing. I'm very interested in helping reverse issues of disease processes, and one of the ones that can be helped are people that have arterial vascular disease. That's the plaque formation in the arteries. Those plaques can be reversed, and if the plaques are reversed, there's better perfusion to the tissue. If there's better perfusion of the tissue, there's the healing, quicker healing, and there's not even ulceration of the disease or the infected foot in the first place. There's not the necrotic foot in the first place. So those patients can be reversed of the disease, underlying disease process. And it's not taking the typical medicines that doctors are necessarily prescribing. There are other ways to do it without side effects with unbelievable results. And I'm a living proof of that because I had a stroke myself 2 years ago. I was doing the right things, and I said, well, I guess I wasn't doing the right things. And I said, no, I was doing the right things, but not enough of the right things. And in 1 year, I reversed my 70% stenotic lesion to about 10 or 15% without medicines, without anything.
He's gonna speak regarding this.
So I will talk to you
Not
about
today,
that on another.
but we're gonna have another conference.
But there are things that can be done, that should be done, and we live in an area with a lot of people with the peripheral vascular disease and diabetes, and they go hand in hand. Diabetes is one of the leading disease processes of killing people at a young age, and the population here is just 50 to 70% of the people have this horrible disease, and that needs to be attacked in a big way by the United Front to reverse what's going on. And it can't be any more just, well, what's your hemoglobin? Well, it's 7. It's 7, or you don't. No, it needs to be down in 4 and 5. Let's get it where it needs to be. And so those things can be reversed, but it's not with just giving a tablet once in a while or whatever and do whatever you want. It has to be another form of education.
Multidisciplinary approach. Guys, we're going to start our conference. Thanks for listening. Share the video. We'll see you here.